All right, guys, welcome back to the Progressive Rehab and Strength podcast. I'm your host, Dr. Rory Alter, head clinical coach here at Progressive Rehab and Strength, with my lovely co-host, Dr. Alyssa Havison, and I guess I should say our guest co-host, but turning into a resident co-host here at Progressive Rehab and Strength, Dr. John Patrizzo, also clinical coach here at Progressive Rehab and Strength, and professor at Adelphi University in the exercise science department. And we're back with another 10-minute tip Tuesday. And this episode, John, it starts after the introduction. It's not, it starts after he's telling me that the 10 minutes starts when
you
I
are wasting time.
All right. Anyway. All right. What we're doing in this 10-minute tip today is talking about bracing belts and your back. So there are a lot of misconceptions about belt use. We're not going to tell you all about belts, and we're not going to tell you what size to buy, what type of belt, what closure, any of that stuff. What we're going to talk about is if belts make your core weak and how you utilize a belt to increase intra-abdominal pressure, stabilize your spine, and improve your lifts. So, John, talk to us a little bit about the myth that a belt makes your back weak or your core weak.
Well, I mean, so what a belt essentially is doing, and the mechanism by which it works, is it's applying pressure to your abdomen. So people have this kind of thought that the belt is something that supports your back, and yes, it does indirectly via application of pressure to the abdomen. So it is essentially it should be constructed of a material that is not going to expand as the pressure is applied to it, right? So for powerlifting, I mean, generally we're talking about leather belts, right? And sometimes in weightlifting they're using some other materials, but um, so the notion that it makes your abdominals weaker is just a fallacy, because in reality it's giving your abdominals something to push against, which allows them to contract harder and more forcefully.
Mm-hmm. So how does that make your core stronger and not weaker?
Well, one, it's going to, so it's the same analogy as like lifting a weight, right? The heavier load that you're going to lift, the more force production that's going to require, right? So that we're obviously, this is an isometric contraction. So by having the belt on and giving your abdominal muscles something to exert force against, right, it facilitates that stronger contraction. Now, from a systemic standpoint, what does that do for us? Well, by increasing intra-abdominal pressure beyond what we would be able to do with just the Valsalva maneuver, it allows us to lift heavier weights, right? Which, again, if you apply that systemically, is making your entire body stronger, right? So if you're able to squat or deadlift a little bit more because of the fact that you're increasing this intra-abdominal pressure beyond what you'd normally be able to, then that load is applied systemically to the entire body, so you're making everything stronger.
Yeah, so it's not replacing your core muscles. It's not turning them off
No.
and doing the job of your core muscles. It's providing additional assistance for those things to work harder. So it's not like if you have 150 pounds on the bar and you're not wearing a belt, your core is working harder than if you have 150 pounds and a belt on.
No.
It actually allows your core to work harder and stronger and lift more weight than you could have. And if you apply 175 pounds to your core, that's going to strengthen the core more than if you applied 150 pounds.
Right.
So it's not a crutch. It's not a cop out. It's not like it's going to shut your muscles off or cause them to start to deteriorate because you've been using a belt. In an effect, it makes your core work stronger, harder.
Right.
Harder.
And just one thing I want to add, because I know that this is coming out like in conjunction with our podcast on the Valsalva.
Mm-hmm.
A belt enhances your Valsalva maneuver, right? So if you have any concerns about increasing pressure and all the things that we talked about in that podcast, then don't use a belt, right? Because a belt only further enhances your Valsalva maneuver beyond
Right.
what you would normally be able to do, and is
Yeah.
really only effective if you are utilizing a Valsalva maneuver, right? If
Right.
your belt is on so loosely
Mhm.
that it's not applying pressure, then it's not really going to be doing anything,
Mhm.
right? And um, if you are volitionally exhaling or attempting to exhale while you're lifting, then you're minimizing the effectiveness of the belt, right? So the belt is really a Valsalva enhancer,
Mhm.
and that's the mechanism by which it allows you to produce more force and lift more weight.
So I hear a lot of people say that when they have their belts on, like now they're going to do something different, or now they're going to breathe differently or brace differently. So, John, should we be doing anything different once we're wearing a belt?
No, the way when I started having people utilize a belt, which is generally not right from the start of their training,
Mhm.
right? Unless maybe they're an older person with a history of back problems or things like that. So these are people that have been training without it. They've built up a base of strength now. They're starting to exert themselves more, and then they become kind of interested in utilizing a belt. Um, and the way that I tell them to use it is you put it on as tight as you can comfortably get it, and you do everything else exactly the same as you were doing before. You forget that you have it on, right? You should not be altering your breathing patterns, the way that you're trying to contract your abdominal muscles. Nothing should change. The belt does its job simply by being placed tightly against the abdomen. You do not have to do anything special to get it to work. You just have to wear it tight enough.
So for people who are taught to push their belly into their belt, why is that not the proper way to use the belt?
Well, because for the reasons that we talked about on the podcast, uh,
The
if
last
you're
podcast for those who are haven't listened to
yeah,
it.
so the um, distension of the abdominal musculature is actually going to decrease your intra-abdominal pressure by increasing the volume of the cavity, which is not what we want, right? Um, Again, the belt works simply by applying pressure to the abdomen. And if you're able to like significantly push your belly out against the belt, you're probably just not wearing your belt tight enough, is how I would look at that also.
Yeah. I mean, but also, there's this idea that you need to like if you are actively pushing, like I just anyone right now, like literally push your belly or your abdomen muscles out, that's like not a safe or comfortable or like natural position to be in. And you wouldn't go lift a couch or carrying your groceries and push your belly out, like you tighten everything up and pull it in and create that
Right.
stability. So you want the the belt is working because it's decreasing the space in the abdominal cavity. It's not that you're pushing against it to increase pressure in your belly. It's that it's creating less space in your belly. And
Hmm.
then so that is how the belt is working, So like I said, or like you said, if your belt is so loose that like it's not doing anything if it's loose. I always walk around and say to my clients, if you can keep your belt on between sets, that's too loose. If I can
Yeah.
fit my whole hand between your belt on either side of it, like that's too loose also. It shouldn't be moving on you, like you shouldn't be able to like twist it from side to side on you, and you shouldn't be like when you're descending into different movements. So like if you're getting into the deadlift position, we shouldn't see the back of the belt slide up. As you're descending into the squat, we shouldn't see the back of the belt slide up on your back. So if we're seeing any movement of the belt on you while you're moving, it's too loose also. So the
And
role of yep.
even if the belt is tight enough and you feel like you can deal with leaving it on between sets, you should take it off to let your
Yeah, let
core
your
like
core
Yeah.
relax.
relax. Yeah. And breathe better. Like you want to be able to get more, like you want to be able to recover your breath after your set. So you want that your diaphragm to be able to descend more.
Yeah, I always feel
Um
like I can't catch my breath. Like if I like left it on like too like
yeah.
if I took a minute to take it off, I'm like
Yeah.
I'm not
Yeah.
hyperventilating.
Yeah, there you should not be keeping it on in between sets. Or I mean, you can keep it on, but loosen it in between your
Yeah, like put it
sets. Like I
on
keep
Yeah.
my belt on in between sets, but I'm loosening it
on a
several
different one hole. Yeah.
Yeah.
But I mean, I think that the important part here is that belts are not a crutch. They don't replace your core muscles. They aren't going to make your core muscles weak. You shouldn't push your belly out into the belt. Your belt shouldn't be too loose. And what this I mean, I guess this concept here of this 360 degree breathing. Any
Yeah.
thoughts on that, John?
No, it doesn't. You can't do it. So it's like
Yeah.
this. It's a. I guess it's like a cue to give you like a visual of trying to.
Bring in more air. I don't
Yeah,
know.
but I mean, again, I just think it causes more problems than it helps. You know, if you are utilizing the Valsalva, you're taking your breath, you're holding it, all of the musculature is isometrically working the way it's supposed to. The belt is going to do its job if it's tight enough. That's all. That's really all there is to it. And again, the way that I look at it, it is a Valsalva enhancer, right? So you shouldn't be doing anything different with the belt than you were doing without. Um, and then the last thing I'll say, uh, because people have this idea that belts support the back, again, the mechanism by which it works is applying pressure to the abdomen. So
Abdomen.
the belts with the really wide back
I
and the
knew that's where you
tapered
were
front,
going.
that is that those are made by people that don't understand how belts work. Essentially,
Yeah.
and I think people see that like, oh, it has more back support. It's like, no, that's not actually what's
That's
going
not,
on there.
yeah.
You
So
wear
Yeah,
don't.
backwards and
right. Yeah.
All right. I think we finished this 10-minute tip faster than the 10 minutes because I didn't hear your timer go
No,
off.
I turned it off. We're over time.
Oh, what the heck? You're supposed to
Yeah.
tell us.
No, I mean it just ended, but
Okay.
yeah, we
All
are
right.
over time. So
All right. Well, so I had a feeling. So that's it for this 10-minute tip. You can find us in our free Facebook group, The Secret Society Barbell Mastery. If you need help with your belt or your breathing, you can jump into that Facebook group. It's free. Get some tips from us. We do free Q&As in there as well, live recordings for the podcast, and form reviews on Wednesdays and Fridays. If you need help with back pain, your belt sizing, or anything, or whatever, you can book a free consultation with any of us. The links to do all of that with the Facebook group and us are in the show notes, and you can join our newsletter to get access to all of our podcasts early. So for those of you who are on our newsletter, you already got this podcast, but for those of you who are just subscribed to our channels, you're getting it today when you're here. All right, guys, thank you so much, and we'll be back with another episode next time. Bye for now.